Hello, my name is Carolyn Brennan. I'm the Director of the Council on Aging in East Longmeadow, which is located in the Pleasant View Senior Center on North Main Street. I am very excited to have this opportunity to be able to get information and resources out to the older adults in East Longmeadow as well as their caregivers. I'm just happy to have this opportunity with LCAT to try to reach as many people as possible. This is our first edition, and I'm very happy, and I think it's appropriate to have our guest here today who's going to talk about open enrollment through the Medicare program, what options are available, and how to get through that maze of picking options and just understanding what Medicare and the health insurance is. So I have Karen Fisk here, who is our Shine Counselor at the Council on Aging. And Karen, I'm going to let you explain what a Shine Counselor is and how did you come to be in this role?
Okay, well, a Shine Counselor, Shine stands for serving the health insurance needs of everyone. So although our emphasis tends to be on people who are Medicare eligible, we do assist others with health insurance needs especially around the topic of MassHealth. But for our purposes here, I'm going to pretty much focus on the Medicare aspect. I really got into this role because the last 30 plus years of my professional life, I was in human resources. And 22 of those last 30 years was spent at West Mass Elder Care. So obviously I've been involved in knowing some of the issues that we face as we become elders. And although I was involved with staff and not the clients necessarily, I learned a lot. So when it was time to retire, I couldn't see just staying home. And just months before I was going to really call it quits, an email came out where the Shine program was looking for volunteers. And I immediately thought, this is something I'm interested in. We do have to go through a pretty extensive training program, so I did have to wait until the training program started. But I did go through that program, and actually, just so people know, each year, because the information can change so much, we need to actually be recertified. So we do have to stay current with what's happening. So I've been doing Shine work for about 2.5 years, and I really, really love doing it. I just find it so rewarding.
And it's so beneficial. I've been in the Age Network for over 30 years, and I would say one of the #1 challenges that those who are about to retire or who, as open enrollment, which I'm going to have you explain in a little bit, it's one of the hardest things to navigate. It's so confusing. So it's really important, and I think it's amazing that you volunteer for this position because it's really like a paid profession to be able to do this.
Right.
Yeah.
I often have people who are pretty amazed that it's a volunteer position. And I just want to mention, as you said something, Carolyn, about it being a maze, the people that come to speak with the Shine Counselor come from all walks of life, from people who are interested because they need information for their parents or someone else that they're providing care for, as well as people with PhDs and very professional positions. They know a lot about the work that they do, but when it comes to Medicare, it's like, not quite sure where to go and how to do it.
Yeah, I know. I get that question when I'm out and about is, do you have anything that will help us understand Medicare and what's available? Can you talk a little bit about Medicare A, B, C,
and D? Right. It's a little bit like alphabet soup. Medicare A, B, C, and D. And if we were in another state, there would even be some more letters. But for Massachusetts, we'll stick with A, B, C, and D. Medicare A is the hospital portion of Medicare. And there is generally no cost for someone to have Medicare A. Usually a person would sign up for Medicare A either, 3 months before their 65th birthday, the month of, or 3 months after. So there's a 7-month window to sign up for Medicare A. And the sign up for Medicare A is through Social Security. It's, you would contact Social Security either online or call and make arrangements to enroll in Medicare A. At the time that you enroll in Medicare A, you do not have to enroll in Medicare B. However, some of the questions that you would be asked to determine if you want Medicare B is if you are in a position where you're working and you're going to continue working and receiving health care benefits, you can delay enrollment in Medicare B. Not only do you have to be working, but if you are covered on your spouse's health insurance and they're working, you can stay on their health insurance. You don't have to choose Medicare B until such a point as you no longer would have that credible insurance. If you are and so someone could be 65, 70, 75 when they go on to Medicare B. Again, it just depends when they've lost their health insurance benefits through their employer. And when an individual is going to leave employee-sponsored health insurance, they actually have an 8-month window to sign on to Medicare B. And when I'm talking about a window, it means we've all heard that there are penalties involved if we don't do it on time. Mm-hmm. Well, the on time for somebody leaving their employee-sponsored health insurance is about 8 months. So then we get to Medicare C. I'm going to skip over Medicare C for a minute and jump to Medicare D. Medicare D is the prescription portion of Medicare. And so when we generally, again, it would be connected to if we don't have employer-sponsored health insurance that provides for credible prescription coverage, then we need to have Medicare D. Medicare C is really what's called a Medicare Advantage program. And Medicare Advantage is a supplement to Medicare Part A and to some degree B. Medicare Advantage covers health insurance needs as well as prescriptions. And the Medicare Advantage programs are really offered through insurance companies. There's a whole list of insurance companies that would offer Medicare Advantage programs. If someone chooses, there's another option to Medicare Advantage, and that is a supplement to Medicare. They're basically called Medicare supplements, and it's generally a Medix program. A Medix program tends to have a higher premium, but once you pay that premium, your co-pays are generally less than when you are on a Medicare Advantage program. So lots of factors have to go into determining what do we choose. I mean, just now I hope I can see people's heads swimming.
Well, my head's swimming a little bit.
And I'm really sorry for that.
No, because, I again, like 30 years ago, it was a little bit more simplified.
Right.
And now it's so complex.
Right.
So if I can backtrack to the Medicare B, what in addition to Medicare A does that, can you give an example?
Sure. Medicare B, when we go to our doctor's offices, for doctor's appointments, when we have outpatient procedures, if we have various kinds of lab tests or medical tests, Medicare B is probably the thing we use most commonly. Okay. Whereas Medicare A is basically hospitals and skilled nursing facilities.
Great, that was helpful.
And Medicare B also would be like for emergency room, urgent care. So both Medicare A and Medicare B have a deductible. And again, that's why we sometimes get supplements, is to help not only with the deductible, but to also help with some of the things that Medicare does not cover.
Okay. I know that often I have heard there's a confusion between MassHealth and Medicare.
Right.
Do you think you could easily explain the difference? I know there's a lot of confusion.
There is. MassHealth generally is assistance for people who are lower income. The income guidelines are very strict, both income and assets. And MassHealth does cover a lot of those individuals' healthcare needs, whereas Medicare does not have those same limited income and asset requirements. Medicare is more for a general population. MassHealth would be for a specific population of
Right.
low-income people who have significant medical needs.
And I think this is a good time to tie in how you do your office hours at the senior center, and when you find somebody who's is eligible for MassHealth, you refer them to our community service coordinator, Janelle Tavella.
Right.
And talk a little bit about that, how you two kind of refer back and forth to each other.
I feel very fortunate to be a Shine counselor at the East Long Meadow Senior Center and to have the opportunity to work with really great people, and especially the connection that Danielle and I have. So as, when someone comes in for MassHealth, they would normally see Danielle, and Danielle would go through the MassHealth application with them. And sometimes then she and I would look over the application just to see, do we have everything before we submit it? As a Shine counselor, I spend most of my time on Medicare, but like today, I had people come in and I was spending time on MassHealth. If I'm helping somebody with a MassHealth application, I make sure that I let Danielle know so that if I can't do all the follow-up, then Danielle does some of the follow-up.
Right.
Because Danielle's there every day, whereas as a volunteer, I have the luxury of only being there. I'm there one morning a week, and during open enrollment, I'll be there one morning and one afternoon a week.
So this is a great time to talk about open enrollment. What does that mean?
Enrollment. All right, so for people who have been watching lots of television and getting lots of mail, open enrollment is October 15th to December 7th. This is an opportunity for people to evaluate what they have had to help with their Medicare coverage. And it's a time when I say to evaluate, because now if people wanted to make a change in their prescription coverage, in their health insurance coverage, we can make that change between October 15th and December 7th, which would be effective in January for the next year.
Okay.
So oftentimes when I'm meeting with people who are signing up for a Medicare program, a Medicare supplement program, I frequently will say to them that, you know, this is not a lifetime decision. If what you have doesn't meet your needs, in October, you would have the opportunity, October through December, you have the opportunity to make a change. Also, our health needs change.
Yeah, that's true.
So, again, it's sometimes people's health gets better. We don't need the same level of prescription coverage. Again, October through December is a good time to really look at all that, and we can make some changes.
And that's where the importance that people will know the mornings that you're at the senior center and how they make an appointment.
Okay. So I will generally be at the senior center every Monday from 9 until 1. And then during open enrollment, I'll be there on Wednesdays from 11 till 3. And in order to coordinate things, if individuals would call the senior center for an appointment, a great crew of volunteers keeps a very accurate count of my schedule. So they will make sure that the information is given to me and that we have a full schedule.
Great. When you were talking, I thought of something. You used the term credible prescription when you talked about that. What does credible mean?
Well, credible coverage. When individuals, I mentioned that an individual has employer-sponsored health insurance for both medical and prescriptions, do not really have to worry about Medicare coverage, Part B. And the determining factor for that is if it's Medicare deems it to be credible coverage. Now, the health insurance provider is the one that would submit a letter to the individual indicating that, yes, you do have credible prescription coverage, or yes, you do have credible health care coverage. It's similar to, I think we all had to do that even for the ACA. We had to, not even the ACA, but when Massachusetts required health insurance. It was just something we submitted so that we didn't have to pay extra on our taxes.
Great.
So the insurance companies are well aware of it.
Okay. So I'm going to speak to a caregiver right now. If they felt that their loved one was having some difficulty with reading mail and reading bills and things like that, and wasn't aware of open enrollment, do they get a letter that comes to the house? Not necessarily the caregiver, but how do the elders know that it's open enrollment time? And especially if there's some challenges where they may not be able to keep their schedule coordinated or where their appointments are. Do they get a letter from?
No, I'm not aware that they would get a letter from Medicare, although the health insurance companies really start sending lots of information to people. AARP sends out lots of information to individuals. There is, I've noticed, television advertisements,
Yes.
Already coming on saying, now is open, or be ready for open enrollment. So although they don't get a letter, there's
enough.
Right. And I know, like, even in the senior center newsletter, we make sure we put it in there that open enrollment is coming, and that's pretty much how it all works.
And I think about the caregiver who's also the concern, it's okay for the caregiver to make the appointment and come in, talk with you initially.
Absolutely.
Is that okay?
Absolutely. I do see caregivers often. It depends on whether we're looking at MassHealth or whether we're looking at Medicare. If the caregiver and the individual can come, that's almost always better, only because if there were any decisions that had to be made, sometimes it's the individual is needed to be there. Although I had an example today of needing to get some information. Actually, this was information from MassHealth, and the person was there who was a caregiver for her mom, and it was great because she was the designated representative. So it's just really a good point that if individuals are feeling like they need more and more help, to really get designated individuals with your doctors, designated individuals on your health insurance, so that other people can make those calls.
Right. Thank you for bringing that up. So I know yesterday we did talk about scenarios. You gave a scenario today. So what I want to try to let a viewer know is that they may be watching this and thinking, oh, mine is pretty simple. I don't need a whole lot of anything else. I think I can just enroll on my own. I think, yes, that's definitely that's an
Absolutely.
option. But what's your easy, for someone to come in and it's really easy, do you find that that someone coming in thinking it's just going to be an easy meeting and you'll be able to get those applications done? Do you ever have a scenario where it was more advantageous because you had that education and could,
Sure.
lead them? I don't know if
Sure.
there's
Again, people can sign up for Medicare A and B online through Social Security. And often what happens when people come to see me and they have, the scenario is, I just got Medicare A and I just got Medicare B, now what? And so we take a look at all the prescriptions that they take. I ask, do you have any significant health issues where you have to go to the doctor or you have to go to specialists very often? Do you have doctors that you just absolutely do not want to change no matter what? You want to keep these doctors, you want to go to this hospital. Those are all questions that we kind of need to put into the mix.
Right.
And so once we have some of that information actually it's called Medicare.gov, there is a link that says Find Health and Drug Plans. And as a Shine counselor, we use that all the time. And again, individuals can use it, but I find that most of the time people would rather we do it. So on the Find Health and Drug Plans, it usually starts out with listing prescriptions. So then we want to look for a prescription plan that covers all the prescriptions. And then if we're going to get into health plans, then we need to take a look further at doctors and hospitals. So although people can do it on their own, I think they like to know that somebody can help them navigate some of the questions that they think of, but they're not exactly sure where to get the answer.
Perfect, because that's one of the messages we want to get out, that even though you think it might be easy and there's not a lot to it, it's still worth making a point with you.
Right.
And then on the other side of that, what is your worst scenario and how it worked out? Like some people might say this is way too complicated and just kind of either don't address it or just continue to be overwhelmed and just kind of let it go. I'm kind of putting you on the spot. Can you think of a scenario?
I think one of my most challenging scenarios was someone who had more health issues than, it wasn't just one event, it was several kinds of things. And this individual was really not that, she was still relatively young, had not only health issues, but prescription lists that went on and on and on and on, and yet still had limited income. So it actually took 3 appointments to really get that individual comfortable with what she was going to choose going forward. I think that one was a success. I felt a success because she seemed to be pretty comfortable with what ended up. I've had one of the most heart-wrenching examples was an individual who didn't seem to have a caregiver, but she herself had some memory issues and had lost her Medicare supplement coverage because she just forgot to pay the bills. But also then some other medical needs were coming up. And again, we were able to get her back on a Medicare supplement that was helpful to her. It just, I know even though when we did that, though, there's still that part, like, I hope she's okay, because the memory issues were definitely there.
Right.
And the other, and it's interesting, it's just been in the last few weeks that I've had people come to me with these huge, long lists of prescriptions. And it's like, what can we do, you know? And again, through the resources of Shine, you've been put in touch with some like Massachusetts Pharmacy Outreach Program. There's different options that we can at least explore with people,
Right.
for some of these just unbelievable expenses.
Right. So what haven't we covered that you want to make sure the viewers want to know?
Just would want people to know, we do this work as Shine counselors because we want to do it and we really want to be of assistance. And also that no question is unanswerable. Again, today I had an individual that I said, I don't feel comfortable giving you that answer. I need to check with someone who is more experienced than I, but I know where to go to try to get the answers. So I'm not going to pretend to have all the answers, but I will work my hardest to find the answers, and I know who to contact. The other is that we're here because we want to help. Everybody's needs are different. And what just flashed through my mind was when we were in training, I could still hear the instructor saying, you're going to get people that will come in and say, my friend told me, or my neighbor told me, just know it's going to be wrong. And honestly, I have found that to be true. So if your neighbor tells you that they don't have to pay for anything, don't believe it. Or believe it, but just think that you might have to check that out.
Yeah.
Because
When sounds too good to be true.
It's probably, right. So there's that one, you know, just everybody's needs are different. So what your neighbor has might not be what you have.
Right.
And actually, even, you know, in married couples, they could both walk out with very different programs. It's not like when we were in the world at work and, you know, the spouse covered the spouse on health insurance. With this, we take a look at what do I need? What does my husband need? And so our plans can be very different.
Right.
So it's not one size fits all.
Right. Well, you were going to say something I can
Well, I
see
was
that?
just going to ask you, now, is there anything else you think we missed? I just want...
I know. What documents do they need to bring in?
Oh,
that was a big one we talked about yesterday.
Yes. If you do make an appointment with a Shine counselor, please, please, please bring your Medicare card, as well as your list of prescriptions. In order for us to use that plan finder to help find the right plans, we need that Medicare number and we need the Medicare card for pieces of information. And prescriptions, when you bring a list of prescriptions, exact dosage is also very important because, again, there's so many different varieties. So those, thank you, that's very important.
Good thing I had cheat sheet here.
Right.
So I can't think of anything else that I know that I wanted to ask. I've learned a lot, and you're in that building every week, and I just appreciate all that information that you've shared. I want to thank Don Mackey for giving us this opportunity to meet and get that information out. And again, please call the Senior Center at 525-5436. Like Karen says, we have awesome staff and volunteers who will definitely get you in the right direction. And I did want to mention that all of the information, Karen, that comes to you from an individual is confidential.
Absolutely.
Doesn't go to anybody else, the
Right.
staff. You mentioned you talked to Danelle, and that's...
We have confidentiality,
Yes.
very important. the information that I get from people is kept in a locked file. We don't leave things lying around. I want to encourage people as well to keep their Medicare card and that information themselves in a protected way. You don't want that laying around.
Right. All right, Karen, thank you very much. I hope that this was helpful, and again, call the Senior Center for an appointment with Karen. This was a great opportunity for our first edition of A Pleasant View on Aging, and Don will keep you informed with cable access with LCAT about what our next show will cover.